My name is Liz Shepherd. I'm lead specialist nurse for alcohol and liver transplantation at the Royal Free. I've been here nearly 13 years. My job is to help the liver transplant team assess patients whose drug or alcohol use have led to the need for liver transplantation. So I meet with patients after they've seen a hepatologist, talk to them about their past drinking, to make sure that they're abstinent now, identify any support needs that they have, and then help the team, together with all the other tests and scan results that we have, decide whether we can put them on the list. It was completely out of the blue. I received a phone call from a colleague who works in another hospital who said, "I've been approached by the BBC. I haven't got the expertise to manage this, but I think you probably have." And so I had a phone call from Ray McBride, who's one of the people that's been involved in script writing, the whole storyline. And we had a very full and frank conversation about what they were looking for from me, but also I felt it was important that they understood from my perspective that it had to be a clinically accurate storyline that was based in reality more than in fiction. There's a lot of stigma and myth around people with alcohol-related liver disease. And I thought the most important thing was that we got a message through about how people get alcohol-related liver disease and what can be done to help them. The second thing is there's lots of myths around how you get a liver, why you need a liver, and the process by which that happens. So those are the first two things, and I was very much aware that the BBC is a public service broadcaster and they have a role to educate. Now, you can educate through documentaries, but you can also educate much more widely by using drama and other mediums. And so when I discussed it with Dr. Doug Thorburn, our clinical lead, we decided that it probably was a good thing to be doing. So every week I got sent scripts via email, and so every Sunday afternoon I'd be sitting at my kitchen table with a red pen, literally going through the scripts thinking, would we do this at the Royal Free? Yes, no, or could we tweak it? And when there were things that I couldn't answer, either to tell them I couldn't answer or to discuss that with my colleagues, just to make sure that everything, because liver transplantation is an incredibly complicated process, and whilst I've got quite a lot of knowledge, there are bits that I know nothing about. So I would always be going back to check, and there were some bits that they wanted a lot of detail on, things like name badges or lanyards or what a room might look like. But for me, there were important health education messages around getting support for problematic alcohol use, and also the whole assessment process that is quite complicated and detailed. Well, actually, me and the rest of the team are very much at the end of the process. So most of these patients will have gone to their GP first. They'll have then been looked after at their local district general hospital. So in this case, it's Walford General. And they'd probably be under the care of a gastroenterologist there. And that gastroenterologist will be caring for them, testing their liver, encouraging them to be abstinent, and engaging them in local alcohol treatment, which Phil Mitchell has had, if people go back in the storyline. However, some livers will recover after that time, but some livers won't, and in Phil's case, his liver has been permanently damaged. He has liver cirrhosis related to his drinking, and so he's been referred to the Royal Free for a hepatologist, firstly to see whether he meets the criteria for being assessed for a liver transplant. So that bit has happened, and then he's referred to the rest of the team, including me, to look at his more aspects of his liver function, look at his psychological status. Has he been abstinent? Can he identify how he will remain off alcohol? All sorts of tests, which some people will have seen if they've been watching. And then at the end of the 3 to 4 days we have the patients in hospital for, we try and make a decision in our NDT meeting, which is on a Friday lunchtime. The NDT meeting is chaired by a consultant hepatologist, the hepatologist of the week. They present the patient in terms of his indication for liver transplantation. They then look at all the scans. They then refer to his nutritional status, anaesthetic risk, then talk about what I think about his risk of relapse to alcohol use, and then putting all those things together, we make a decision about whether the benefit of a transplant is worth the risk for that particular patient. We would expect that mostly to have been done before they come to the hospital. Sometimes that hasn't happened, and that would often delay them onto the list because they need a bit of extra support. But at the Royal Free, we've developed a new clinic, our liver transplant assessment clinic, where we see patients much earlier on in the process, and they see everybody in an outpatient setting, bam, 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 hopefully quite quickly and easily, so that we can identify which bits need sorting out first before we bring them in for an inpatient admission. Yes, one of the things that we work with patients is not just about what's happening at the run-in to transplantation, it's about supporting them whilst they're on the list, making sure they're not drinking, giving them advice, support, referring them to local services if they need it, because you have to remember that many of our patients come from very far away. Our catchment area covers Essex, Buckinghamshire, Hertfordshire, all over the place. But also after the transplant, it's no good putting lots of things in to help people before they have a transplant. Actually, the time they're at most risk is afterwards, because afterwards, I often say to patients, we transplanted your liver, not your brain. The reason why people may have drunk to excess may still be there, and they will need help and support managing that, and we try and do that as best we can. We see a lot more men, so roughly 70% men, 30% women, roughly. There's lots of reasons for that. Women often present a little bit later on. Often they have smaller livers, they have less reserve, so they're more sick, and that means that sometimes they just don't make it onto the list, or if they are on the list, they have to wait a longer time. So the majority of our patients are men, but we see patients from just about every single walk of life. Problematic alcohol use doesn't discriminate in that way. After patients have had a transplant, if they have a smooth course, we'd expect them to be out of hospital in about 2 weeks, roughly. It's a variable course, but a lot of patients are out within 2 to 3 weeks. They're then followed up in outpatients, initially weekly, then 2 weekly, and then we spread that out. And during that time, me or my colleague Andy, we're there in clinic every single week to make sure that if there are problems, we pick them up early. So we support the patients all the way through the process. It's a one-stop clinic, so we see a hepatologist, me, sometimes a liver transplant coordinator, and we're there to support the patients. I think it's really important that people know that this group of patients do really, really well. All the literature says that less than 10% of patients go back to alcohol use that hurts their liver. And at the Royal Free, actually our relapse rate is even lower than that. Many patients live for many years, 10, 12, 15, even 20 years after their transplant, if they don't return to alcohol use, take their medication and use the support that's here for them. And I suppose that's one of the things that makes my job really worthwhile. When I first meet with patients, they're very anxious, they're scared, they think they're going to die, they're often very regretful of their past drinking. We're able to support them, and I've had the privilege of knowing some patients for nearly 13 years now, and they're alive, living happy, productive lives because of the work that we do here.